I'm officially 40 and it's time I started taking aging a little more seriously. Hi, my name is Ivy. I'm founder of Ivy & Fields, your favorite clean living marketplace, where you can support small brands making the best in non-toxic products. Now, living in Miami, you might think I will be turning to Botox for my aging needs, but I'm a non-toxic girly, so we are going to do this neurotoxin-free. In this series, we'll talk to experts on how we can support our body and our skin internally, the external habits and routines that we can adopt, and exploring the naturally minded professional help that is out there. Because you do have options way beyond Botox. Now, you might be tempted to fast forward through this first part on aging from within, but the evidence is clear. Aging begins inside. For more on this, I went to visit Sunflower Family Medicine, a naturally minded practice, and spoke with NP Jessica Rodriguez. So, Jessica, I imagine you are often talking to your patients about eating healthy, getting sleep, but how do these things affect our aging?
Sleep is your number one. If you're not sleeping well, you're not recovering, your body's not recovering, your mind's not recovering, you're going to be chronically stressed. So sleep is your biggest thing. So I always ask in every single visit, how do you sleep? What's your diet? What's your exercise regimen? And how do you sleep? If they tell me they're not sleeping, why are you not sleeping? Are you stressed? Is there something going on? Do you need to see a therapist? Do you need to decompartmentalize? Sleep is one of those things that puts such a stressor on your body, and it's multi-factorial, right? And it's multi-organ damage that you're doing if you're not sleeping because you're not recovering. That's why I always say, like, babies need to sleep because they need to grow. Growth factor is released at night. So if you're not sleeping, you're not recovering, you're damaging your body little by little. And then diet and exercise, just getting up and moving around every single day a little bit, every single day accumulates to a lot. So I get patients who come in here and they'll be 3 months off the couch. Oh, I'm going to go and go straight into CrossFit. I'm like, no, that's not a good idea. Let's go slower. So let's walk, 1 block, and then the next week walk 2 blocks, and then the next week walk 6 blocks. So you just add a little bit, and then at the end of 3 months, okay, now I'm ready for CrossFit. But you can't just kind of get off the couch. That's a little aggressive on your joints, and you're going to do more damage than good. And then diet is kind of just eating well-rounded, eat what feels right to you, eat what's intuitive. Obviously,
whole foods, less processed.
Whole foods, less processed is 100%. No oils, no seed oils, that kind of thing. Nothing that's inflammatory. I'm not a super big dairy person. I don't like dairy that much. I think it's very inflammatory. And I think you can get your vitamin D and your calcium from other sources, like broccoli and cabbage. Other things can give you vitamin D that you don't need the whole milk for.
And how does inflammation specifically affect aging?
So inflammation, you can feel super bloated. You don't feel good about yourself. You can get that puffy face, like under your eyes. You get puffy fingers. You wake up in the morning, your joints are really stiff, and it's all that inflammation. So
harder to move
big time. So I do a ginger and turmeric and pineapple shot most mornings. Pineapple is anti-inflammatory. I try to I love salt. I think salt is a great thing in our body. I think our body needs salt to absorb the water in our body. So I'm not anti-salt, so that's a little strange. But I love like pineapple juice and ginger, turmeric, that kind of thing to cause a lot of natural inflammation reduction.
Yeah. Any other foods that you'd recommend we should make part of our everyday diet?
Probably grapefruit. Grapefruit is so good for you, depending on what meds you're on. If you're on any medicines, grapefruit can be contraindicated depending on the medicines you're on. But grapefruit is so good for you. Pineapple every single day. I love pineapple, and it reduces serotonin, so you feel happier when you eat pineapple. So I love pineapple. Tomatoes are great. Tomatoes are full of nutrients that you need. However, too many tomatoes can cause a little bit of inflammation, so you gotta balance that out. Watermelon is always good. Cucumber is always good. A little bit of lemon is great for you. So I think it's clean. They always say, and I read a book a long time ago, if you can shop on the outside of the grocery aisle, that is the most important part. So anything that you can get on the outside, you're doing much better than anything that you can get on the inside.
Yeah, 100%. That's actually a tip on my grocery shopping hack list.
Yeah,
is to walk the perimeter and only walk down the aisles that you know exactly what you need to go get. Yep. Otherwise, you will impulse buy, and what you're impulse buying is probably not
never
good for
shop
you.
hungry, right?
And never shop hungry.
And then another thing that I always see people, I use olive oil. I'm like, yeah, but if you heat up olive oil, now you've made it into like masola, right? Like the old school cooking oil. You haven't done anything with olive oil. So I always cook with, something that can tolerate high heat. Avocado, coconut, beef tallow is what we use in our house. Things that are, going to keep that inflammation down. And then what I love to do is that I have a really clean organic olive oil at my table. And if I serve myself tomatoes, cucumbers, fish, rice, beans, whatever I'm going to eat, depending on the day, I always put uncooked, unheated olive oil all over my food. And I do use salt, and I use iodized salt because it's so good for you, And it kind of just depends on your lifestyle.
Yeah. Okay, great. Let's talk about stress, because chronic stress obviously affects so much of our life. But because this is specifically on aging, what is the science there of how stress is affecting?
So stress affects your organs, and high stress leads to high cortisol levels, which kind of break down your organs a little bit at a time. So every day that you're stressed out, your organs are being more stressed out, and you kind of look tired, you know, if you're walking around like this all day and you're kind of grumpy, you know. So you start to look older. If you're super stressed, you're not resting well, your skin you're not hydrated as well as you should be, and then you get the fine lines and the wrinkles. Your hair can fall out. Your nails can become brittle. If you're very high stress, you lead to high blood pressure, which means that your kidneys are not functioning well enough. So you're kind of, you know, stress is just it'll beat down your body. There's just no other way to say it. It'll beat down your body. It almost
distracts your body from doing what it's supposed to be doing, focusing on something else rather than rebuilding your collagen.
You got it. Our bodies like to be kind of happy and healthy and have everything kind of balanced. And when you have something like stress that's thrown in there, it's spending so much time trying to recover from the stress that it cannot recover from anything else. So that's why they tell you when you're injured, go home and rest, because they don't want the stress on your body. You need to rest your body, because during rest is when growth factor is released at night. So if you're not sleeping, you're not growing, you're not healing.
So let's talk about hydration, because obviously that affects the way our skin looks.
Oh yeah.
And also tell me, do we need the electrolytes? Do we need supplements for it? Or is it just drinking water?
Drinking enough water is really important. So I weigh 120 pounds. I should be drinking about 60 ounces, which is really tough to do because I'm in between patients and it's hard to remember to drink my water. Hydration really depends on your lifestyle as well. So if your spouse works out 15 times a day, 15 times a week, obviously they need to hydrate more. I'm a sauna believer, so I go in the sauna at least 2 or 3 times a night. I have a sauna in my house. I'm sorry, a week.
Oh, I was going to say, wow, you're committed to 2 to 3 times a night.
And then I don't do anything else. Go home and go to sauna. No, so I try to go in the sauna at least 2 to 3 times a week, which those days I really have to hydrate, right? Like I really have to pay attention to my hydration. I'm drinking more than 60 ounces that day. But hydration, they always joke that if you're super hydrated, you have less time for drama, right? Because you're in the bathroom so much. So that's really good. That lowers your stress. But if you are super active and you're working outside, then yes, you need to be including those electrolytes. If not, I'm indoors all day. I don't sweat most of the day. I'm just a water girl. I do try to add salt to my food, like I was saying, but I'm just a regular water girl. My husband is an active firefighter who works outside. Those days that he has a fire, he does need to add an electrolyte powder. My son is an active wrestler. He does have to have an electrolyte powder, that kind of thing. I like an electrolyte packet depending on lifestyle, depending on what they're doing. But hydration is so important. You know, hydration, it fuels your muscles, it fuels your organs, it fuels your brain. Your body's 90% water. It needs that water to run around. Otherwise, you're starting to do damage. You know.
Yeah.
And your skin is your biggest organ, and it needs the water to look pretty.
Yes.
On top of everything else.
To quench your skin.
To quench your skin for sure.
As we're aging, what have you seen in practice are maybe some of the vitamin deficiencies or other deficiencies that we may experience that we should pay attention to?
So I know you're about to turn 40, right? That's the big thing with this. So as a 40-year-old woman, and I'm almost there, so I get it, we really need to pay attention to our vitamin D levels. That is your biggest thing, right? So we should be doing weight-bearing exercises, making sure that we don't lose our bone, our bone density, and that happens with estrogen loss. So if you're not going to do hormone replacement therapy to kind of make sure that you don't lose it, and that's okay, some people are against it, I'm not, but some people are, then you really need to pay attention to your vitamin D, your calcium, your vitamin K2, so vitamin D3, K2, and then I love a zinc supplement, and I think everyone would benefit from that, and then magnesium. Everyone always asks me, like, what multivitamin do you take? I don't take multivitamin. I take vitamin D.
Targeted ones.
I take my targeted ones based on what I'm missing. I do often get asked about like oral collagens. I think that has to be a really clean collagen that you've really looked into. I don't take an oral collagen. I do take a biotin, but I don't take an oral collagen just because I just don't see the good data on it. Not to say that there's not, I just haven't found any that I trust. If they find a really good one, please let me know. I just haven't found any that I trust, but I do take a clean vitamin D that's, organic and vegan and all of that. So I think the most important part if you're going to start a vitamin regimen is go to your practitioner, come here, we'll draw labs and see what you need and what you're missing and what your symptoms are, because there's different levels of vitamin D. Some people say that the lab says, up to 30 is your minimum. I say 70 is your minimum, so it kind of just depends on your practitioner on if you're trying to optimize yourself, if you're trying to be functional, if you're just trying to be healthy, but I think I want to feel great. I want my vitamin D above 70. Right. If you do too much vitamin D, you can increase your chance of getting kidney stones and that kind of thing. So it has to make sense for you and your lifestyle.
Yeah. I'm actually, a lot of my followers know this, I'm not a huge fan of supplements and buying random supplements that you get Instagram ads for.
I totally agree.
You should be going to your doctor and doing labs, and then from that information, replenishing whatever you might be deficient in.
You got it. Yep, that's correct. Yeah. And most providers don't do those kind of labs. You really have to ask for extensive labs. Like check my selenium, check my zinc, check my iodine, check my vitamin D, check my magnesium. Those are things that are not typically included in like a regular, lab draw.
Yeah. All right, now we're going to get into what everybody wants to talk about, which is the aesthetic treatments. And many people assume Botox is the only option, but we actually have many naturally minded alternatives that you can consider instead. So Jessica, I want to start with NAD because this is, the Kardashians were on a video one day talking about NAD and they're going to live forever. So what is NAD and does it work?
So NAD does work. I'm not even going to pretend to say the injection. It's nicotinamide adenine. I am terrible with...
we'll get it in the shop here.
So NAD is wonderful. NAD has 2 different doses, so 250 milligram dose. That's just for skin, so you would do that every single week. And that is going to give you that beautiful glow, that anti-aging glow. And it works on the cellular level, so it makes you produce new collagen. It makes you produce new cells so that you look beautiful.
And in your office, you do the IV infusion?
Yes, so in office we do a protocol. It just depends on which protocol and what office wants to do. I follow the basic protocol, the one that mostly everyone follows, because it's the one that has the most data behind it and it's the one that shows efficacy. And I like to do everything kind of like, by the book. So NAD 250, we would start IV, you would do IV a couple doses, and then we would switch to injectables, and you can do them at your house. And then if you're looking for the cognitive benefits, then you would switch to 500 milligrams. But if you're looking just for skin and that beauty, you want to stay young forever, NAD is your best. I mean, I love NAD.
And how long are these treatments?
So you could do it indefinitely. The IV in-house takes about 2 to 3 hours, depending on how the patient feels. And then it takes, a minute to inject yourself at home between setup and throw away. But you could be on this forever. There's
like 2 to 3 hours you're connected to an IV?
To an IV.
Wow.
Just because it doesn't make you feel great at the beginning. So it's kind of self-titrated. So you go up or down on the IV to see how you're feeling. But most patients take about an hour to an hour. I've had one patient that takes about 3.
Okay.
Women tend to tolerate things a little bit better. Okay. Just because we're moms. Men typically take a little longer.
We've been through it.
Yeah. Men typically will be here for like 4 hours, but women do well, 1 or 2 hours, and they kind of bang it out,
And then the frequency of this, what is typical?
So at the beginning, it's once a week through IV, and then we switch after the 4th IV dose. We switch it to just 2 to 3 times a week, depending on how comfortable you are with injecting yourself. So you could do either once a week or 3 times a week.
And this is indefinite?
Indefinite, you can be on this indefinitely, yeah. There's oral NADs. They're not processed as well in the gut, so you're kind of wasting your money when you're doing an oral NAD.
I've heard the same, but it's not.
You're kind of throwing away your money there. Like an injection is the way to go.
Right, the most bioavailable to get it right into your...
Yeah. There's no recovery, so the second that you stop the infusion, you feel amazing. So I've done it while working, I've done it while seeing patients, and I feel fine. It kind of just depends on you. I've had one patient, a man, who said he had to go home and take a nap afterwards. Okay. But women don't have that problem. We do it during lunch, we do it during break. I've done it seeing patients. So there's an IV stick that we hang the IV, and then you just walk around with the stick.
Okay.
But I've seen patients connected.
Yeah. Nice. All right, now talk to me about peptides.
So it depends on what the patient is looking for. If you're looking for anti-aging, so 𝐀𝐠𝐲, it's a copper-based peptide, and it's fantastic for, as we age a little, we get like the thinning hair. So that's fantastic for hair growth. And then let's say that we get like that discoloration of skin, so melasma, or as you get a little older, you get the red little hemangiomas, the little red spots that like us girls get. Peptide, the 𝐁𝐻𝐸 is perfect for that. We have foams, we have creams, and then we have the hair shampoos, the washes, we have ointments, so we can get that. 𝐁𝐻𝐸 is the best, I love it. We have it topical or injection. And then if you wanted to do dual blends because your body is like super fatigued and you wanted to do, you're feeling like you need a little bit better muscle recovery and joint building and like elasticity, then we would introduce a dual blend. And that's an injection. So you would do that 3 months on, 3 months off, 3 months on. And that's an injection as well.
And this can also be done indefinitely?
Yep. Yeah, pretty safe, yeah. Unfortunately, that none of them are FDA approved because everything good doesn't get FDA approved. But they're approved overseas, so that's a good thing.
Yeah, okay. Yeah. What's the recovery on that as well?
So again, no recovery. Yeah, you inject and you go. You feel great.
It's like taking a vitamin.
Like taking a vitamin,
okay.
Yep. Yeah, and I think that's how we need to look at peptides, is like taking a vitamin. Like you just make it part of your daily routine.
And the results on that, what is typical? Do people see something after 1 treatment, 2 treatments?
They don't. Not with peptides. You usually will see something in about 6 weeks, 4 to 6 weeks. If we're doing like a dual blend and we want to see recovery numbers, then we would look at labs, pre, during, and post. And then as far as like 𝐁𝐻𝐸, we would take pictures before and after. But you could see some results at 2 to 3 weeks, but like great results happen at 6.
Okay. All right. That's still pretty quick.
Yeah, it's pretty quick.
So now for those of us that are maybe willing to get other types of injections that aren't Botox, talk to me about PRP.
PRP and PRF, they're both injections that you do to the face, and it just depends on why you're doing them. So PRF is kind of like a filler, but it's your natural made filler. So you come in, we draw your blood, we spin it down, we cool it, we create like a gel, and then we fill in spaces. So think of that like if you have like the nasal labial folds, if you have those like long, some people get like the marionette lines, we could fill those in. And it's totally natural, it's 100% your skin. There's no reaction, there's no chemicals, it's just you. And then the way that that works is the same idea as PRP. PRP is creating micro damage to your face. So if you have a lot of scarring, if you have those fine lines on your skin, like people that have the fine lines here and the fine lines here in those areas, PRP works on the surface level. It doesn't really work on that deeper level how like a PRF does. So PRF, think of it for also under eyes. We can get really good results with under eye bags and like the discoloration. And then PRP is the same idea, but it's done on that top level. They're not super painful. They hurt a little tiny bit. It's very tolerable. It's just like little needles that happen to the surface of your skin. And the way that that works is that platelet-rich fibrin or platelet-rich plasma, which is what PRP or PRF stand for, what that has is growth factors. So it's all about these growth factors that, unfortunately, as we age, we start to lose a little bit of them. So we kind of have to remind our body, hey, come back, you know? So you introduce an injury, right? So a micro injury, or you introduce an injury under the skin, and then your body signals itself to say, okay, I need to send red blood cells, white blood cells to heal that area. When they get there to heal, they reach the PRP, which has those growth factors, and then they heal beautifully. So you're kind of healing from the inside out. So it's the most natural way of making your skin glow. And we you know, it's like the vampire facials that the Kardashians all use. That's PRP. So you do end up a little bloody. Downtime is not much. You know, you're a little red that day. We do a cooling mask for you to make sure. We put a hyaluronic acid if you're interested. We put a vitamin C serum if you're interested. And then we put a retinol serum if you're interested. And so you leave kind of glowing. I always like it for like brides because the next day you kind of get rid of all that dead skin and you look so beautiful from within, you know.
So this is pretty fast recovery, actually.
Oh,
next day you can get married.
Okay. Next day you can get married. Depending on your skin type, right? Like if you're a person who bruises a lot, you do get petechiae, which is like micro little bruising. I haven't had that happen to anyone other than one patient, but she's very, very, very fair. And then you could always cover that with like a foundation kind of thing.
Makeup.
Yeah.
And the frequency that each of them need to see results?
Once a week, once a month, kind of as much as you can tolerate, as much as you can afford. And the results are beautiful. You know, you're kind of always building. You're never going to go backwards. You're always going to build on top of what you've already done.
So you won't lose the benefits if you stop for a couple of weeks and then go again.
Yeah.
Okay. So you can maybe almost do it too as needed, or?
Yeah, I like to tell people at least 3 times a year, 4 times a year. Quarterly is fantastic. At least twice a year is even better, or is tolerable, is good. I like to do it all the time, you know, as much as you can tolerate.
Well, you have your own lab here to do it.
Yeah, that's true. I cheat.
The benefits. Now, I know we're here to talk about Botox alternatives, but actually learned something new by talking to Jessica is that there's more than one Botox option. So can you tell some of our viewers about the lower tox option?
Yeah. The only 2 toxins that we use here in-house are 𝐁𝐁𝐿 or Daxxify. We primarily stick to 𝐁𝐁𝐿. And the reason is because it's the only one on the market that has no preservatives. So Daxxify does have a peptide based. It's a little bit more expensive, so it's not super affordable when it comes to tox options. At the end of the day, they are all toxins, so they're going to paralyze the muscle. But the cleanest version of a tox that you can use, I would say, is probably 𝐁𝐁𝐿. I love 𝐁𝐁𝐿. It's the one that I use. It's the one that you can get movement without wrinkles. So I have tox right now. And I probably do it twice a year because it's a really good product and it lasts a long time. I happen to think it's the one that lasts the longest, even according
which is why it's so popular, because the effects are immediate.
The effects are immediate, so you'll see some results in about 7 to 10 days, and then you can hold those results depending on your activity level, your sweat level, what you do for a living. If you're a person who's standing over a hot stove, you're not going to hold tox, you know. But somebody like me who works in an office most of the day, you can hold tox for 6 months, you know. I love 𝐁𝐁𝐿. It's the cleanest one. It's the only one that I would be comfortable with injecting in my face because it's the only one that has no preservatives. It doesn't have any of that, you know, gross stuff.
Yeah. So it is still a neurotoxin, so I cannot officially endorse it on behalf of Ivy and Field. But if you're watching this and you're like, that's cute, Ivy, there's no way I'm giving up my Botox, now you know that you at least have some options and you can talk to your provider about choosing a safer one. Is there anything else that we haven't yet discussed that would be a good option for someone looking to age naturally but looking for some help?
So we have a laser in-house. It's the Candela laser, and it does have for like diffuse redness and fine lines and wrinkles and that kind of thing. And the way that that works is that it heats up. It's really, really, really tolerable. It just gets a little warm, and we kind of paint the face. It gets really, really hot, and then that tells your body, I need to bring collagen to that area. So the only caveat to that is that you have to tell the patient you must hydrate because it's going to be trying to bring all of that fluid to that surface level. So the fluid has to be there to hydrate. So you tell the patient you have to hydrate the day before, you have to hydrate the day after, so that you can really see the results. And they would do that.
And is this normal hydration, or this is even beyond what you normally?
Just normal hydration, you know, the correct amount. So those 60 ounces.
Which most people don't do, so that's why you have to tell them.
So about those 60 ounces for like a 120 person, right? and they would hydrate, and then they would see those effects. And you can do that weekly, you can do that daily. I mean, the results, again, you're kind of just building on those results. And on that laser, there's no EMS, so you're not worried about, like cancer or any of that.
That was going to be the next question, because I'm sure people are concerned about laser.
That was one of my biggest caveats when I bought that machine. I just wanted to make sure that it was going to be safe. And it is so safe. It's used to treat skin cancer. It's a very safe, and it doesn't have any of the EMF or Wi-Fi or any of that stuff, no waves.
Who can qualify for this kind of treatment?
So most people can qualify for the laser. It kind of just depends on skin tone and if they've gotten sun in the last 2 weeks or if they're going to get sun. And then if they have any history that we need to look at. But most faces, most skin, and we do the neck, the chest, we can do arms, we can do everywhere. Most people are good candidates for the laser, especially the Candela laser.
And if you're doing targeted treatment for, let's say, trying to reverse sun damage, how many do you have to do? How frequently?
So I would say at least once a week for at least 3 months. And we sell packages for that just to make it kind of affordable. And again, you're never going to get worse than where you started. You're always going to be improving. So I guess I would say probably until they see the result that they want, But it's always nice to get a little touch up when you come. Like if you're going to do a tox, if you're going to do a PRP, if you're going to do a PRF, come in and get your laser as an adjunct to your treatment.
If you're in South Florida, obviously you need to come down to Sunflower Family Medicine to get these treatments done. But for those of you watching who aren't from sunny South Florida, what are some of the credentials that people should be looking for when they want to get these types of treatments?
So I would say your biggest thing is look and see if they're a licensed professional, so MD, NP, PA. That's your biggest one. You shouldn't be going to like a person who's not, one of these like little hair salons that has like a random esthetician in the back. No, they should be licensed professionals, somebody who knows, somebody who hopefully you've gotten some good reviews on and you've looked into them. When you walk in the facility, if it's not extremely clean, walk out of the facility. They should be wearing gloves, masks. They should not be touching you without a glove or mask, that kind of thing if they're going to be in somebody's face. You just have to feel comfortable. And then obviously like great reviews, a peer review, ask your friend, hey, what do you think about this person? But they have to have a license.
I remember you shared with me also they should have some sort of emergency protocol should there ever be.
Absolutely. So they should have an AED machine in-house just to make sure that if you have, God forbid, an allergic reaction to it, they have the machine. They have to have their BLS or ACLS, which are like CPR cards. So they should be licensed and credentialed to do this. All of their machines should have like a green tag to say that everything's up to date so that they're getting inspected every year. Their facility should be inspected.
I see a lot of concierge services for some of these things. How do you feel about that?
So when I started, I used to do concierge. It just depended on the patient. So I would go to patients' houses. With Botox, you're not really going to have an allergic reaction. If you're doing filler, if you're doing like store-bought filler, right, like a commercial filler where you're using chemicals, you do need to have the antidote to it because you can have like an extravasation of the filler, and that's a very dangerous situation. So I probably wouldn't do filler in anyone's house. I would say that has to be done in facility. PRP or PRF needs to be on a calibrated centrifuge, and that shouldn't be moved. So if you have somebody who's coming to your house to do PRP, PRF, you're probably not getting the best PRP, PRF. It has to be on a stable table, it has to be balanced, and it has to be calibrated in that specific location. So that's another, I think the only thing that we could do in someone's house as far as concierge is probably Botox. Yeah. I mean,
NAD?
NAD you could do if they're traveling with their kit.
Yeah.
IVs and that kind of thing, like preservative-free IVs that we offer here in-house, like for vitamins, nutrients, that kind of thing. You can do in someone's house if the person is traveling with an emergency bag. Benadryl if they need it, Medrol, prednisone, things to stop whatever reaction you may have, and a little AED kit just in case, or like a good phone that'll call 911, Yeah, but you want somebody to be able to step in and stop whatever's happening immediately.
Right. If you had to pick just a few things from everything we discussed that is going to help us age gracefully, what would you say is the most important?
NAD. I would spend all my money on NAD. You're going to cause healing from within. You're going to give yourself the cognitive benefits. So you're going to feel great. You're not going to get Alzheimer's. You're not going to get dementia. And you're going to look beautiful while doing it. And then I would say probably PRP, just because it gets rid of all of that dead skin cells that we have kind of covering the top layer of our skin, and it tells your body to bring out the new stuff. So I think those are my top two.
Top two Botox alternatives.
Yeah, I would say NAD 100%, and then PRP.
Final question, and I know you're a professional, so you would never do this, but what is something that if you had your patient right here in the room and you just want to yell, do this to be healthier, what would you say?
Drink water, right? Drink water, water, water. Drown yourself in water all day.
Everyone's dehydrated.
Everyone's really dehydrated. I can tell you all the labs that I look at, everyone's chronically dehydrated. And put a little salt in your water in the morning.
I'm probably really dehydrated.
Get a really good, clean salt, like a Celtic salt. I like iodine, so I say get a good iodized salt and put a pinch of salt in your water every single morning. That way you're really absorbing the water that you're taking in, because salt tends to cause retention, and you want some water retention. If not, you're kind of just peeing it out. Like, you don't want to have clear urine, which is a total misconception. You want some color in your urine. It tells you that you are flushing out the things in your body, and that's what you want. If you're just having clear urine, you're not absorbing.
It's just moving straight through you and not taking anything with it.
You got it. So that salt holds onto that water. So I would say drink water.
All right. Well, thank you so much. I think we've learned a lot. I think maybe the most important lesson is that no amount of treatments or fillers can outdo an unhealthy lifestyle. And this seems to be the trend. And everyone that I've interviewed, just the basics to being healthy are also the basics to looking and feeling your best as you age. So that's the takeaway, I think.
I agree. Sleep, 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 and drink water.
There you go.